COMBI-AD is one of the first studies, or the first studies with targeted therapy, a dual MAP kinase blockade using dabrafenib and trametinib in patients who are free of disease of melanoma. These are stage 3 melanoma patients, so patients who got operated on their sentinel node and got elective lymph node dissection. And we know that this patient cohort has a roughly 70% relapse chance over the next 5 years. And these patients got treated in a placebo-controlled study, which was a registration study comparing placebo to dabrafenib. These clinical trial results have been presented and published end of last year after ASCO last year, and have shown a strong and significant benefit in favor of dabrafenib with a hazard ratio of 0.5. So it's a clear benefit, and actually with a survival time of close to 28 months. It showed also an overall survival benefit at that time point already, which was highly statistically significant in favor of the combination. So the question also was the safety profile of this combination, since roughly 25% of the patients dropped out of the treatment. The treatment duration is 1 year. And roughly 25% of the patients dropped out because of side effects. The side effects we know from dabrafenib, also in the stage 4, are mostly pyrexia, fever, and patients in stage 4 having a metastatic disease are willing to accept more toxicity. There is a life-threatening disease if you have distant metastasis in your body. In the adjuvant setting, the patients are free of disease, they feel normal, healthy, and if you have chills, if you have fever, particularly in the beginning of the treatment, there are some patients who have a higher likelihood also to walk away from the treatment. So quality of life was measured in those patients staying on track, and clearly demonstrated that the most important thing for a patient, obviously, which is affecting quality of life, is tumor progression. So obviously quality of life is improved in those patients who are free of disease, and which is possibly not surprising, but I mean that's quite obvious looking at these patients, that progression is also having a major impact on patients' quality of life.
So I guess the summary is that the combination works, and for those who do tolerate it, the outcomes are?
Yeah, I think one of the lessons we have to take is patient education, to manage expectations of what to achieve, and also the expectations of what kind of side effects one can expect is of critical importance. If a patient knows that fatigue or fever might come, how to deal with that is of critical importance. So a brief stop of the drug, treatment pause, is not harmful. We know that already from stage 4, and then continue without affecting your quality of life too much, and then to overcome this initial side effect peak.